Ever since I have been in quality, I have always wanted to outsource our abstraction methodology. We have nurses who need to work at the top of their license. By doing the abstraction at their desks, quality is no longer visible, and they're not able to spend that time with the staff and with the physicians on the floor. That in our office alone has taken probably 60% of their work time that is now freed up from not having to do abstraction to making those improvements, and that is vital, and especially at a time when resources are at a premium. When I researched the 3 competitors that I was looking at for outsourcing our abstraction, I felt Q-Centrix stood out for several reasons. As an organization, I was also looking at other departments who may also need to free up nursing resources. So Q-Centrix was the one organization that also does abstraction for tumor registry, STS, or cardiovascular surgery type of databasing, as well as infection control abstraction for the NHSN. And all of those are what we do on this campus at Carson Tahoe as well. So I felt, let's get the biggest use of Q-Centrix, and the other competitors just did not offer that diversity. I put together the competitors side by side and did a return on investment comparison that was presented before the executive team. I had no problem getting Q-Centrix, and it was obvious which one was the winner. I was actually hoping to only outsource about 6 measures by the end of the year. Our transition to outsourcing went so smoothly, and the direction provided was so clear, we were actually 100% outsourced on our abstraction by the end of the year, and we didn't get started until March. And that was 100% abstraction for both of our campuses within the Carson Tahoe Health system.
I feel that we really are an extension of their department, and an example of that is with the tobacco measures. They really reached out to us and asked us what we thought would work, what documentation would help them be successful, and we were able to look at that together.
It didn't take us long to get set into a definite pattern to where we focused on those charts that Q-Centrix said we were falling out on. And our last Oryx report, we were at 98% composite.
When you start with a partner hospital, it really is all about gaining their trust and establishing a rapport with them. And once you're able to do that, things do run very, very smoothly.
The value with working with Q-Centrix is the fact that they do the tough work. They abstract all those charts. But the advantage that we have is we get the clear, concise feedback on where our outliers are. From there, our quality specialists are able to take that information, go have those conversations with the nursing units and/or the medical staff to make the improvements that are necessary. Our staff love no longer having to sit in front of a computer. They went into quality to do the hands-on quality improvement. They're now freed up to do that. So for my staff, it was truly a freeing of their time. And now then they're able to do what's most important to them. And for me, that retains staff, and that's huge.